this is maybe the first or second year that we're having a talk on eye care and eye health. So thank you for coming. We'll give I have no financial disclosures, just so everyone knows. The introduction on general eye health and tips on how to have pretty healthy eyes. I'll talk a little bit about the current eyelash enhancements that are out on the market, and also the latest advances in surgery at Loma University Department of Ophthalmology, which is now called the Eye Institute. And then at the end, we're going to have a raffle drawing for a Latisse sample. So what you should know at your doctor's office, I have a little cartoon here where the doctor is telling the patient, you know, your eyes are just fine, just some eye charts are, you know, a little bit too small. But, you know, when you do go to your doctor, you should know that you're getting a visual acuity check, which is on the eye chart. They should be checking your eye pressure, which ranges from about 10 to 21. A refraction for your baseline prescription. Also, make sure that they're checking your visual fields or the peripheral side vision. Some doctors include a color vision check to make sure that you don't have any color deficits, and also to make sure that you have the appropriate motility with your eye movement. So some patients that come in with double vision, their eyes may not be aligned properly, so that's really important to check for. Also on exam, you should have a slit lamp exam with a microscope and then a dilated exam, which will include evaluating your retina. They wanted a take-home message, so I thought I'd draft 10 tips for healthy eyes. And first is to get your regular annual eye exams, especially if you're over the age of 40. Generally over the age of 40 is when you start to become presbyopic or lose the ability to accommodate or focus up close. Also, using sunglasses for UV light protection can prevent the onset of cataracts. Eating leafy green vegetables, dark berries that have antioxidants in them, and cold water fish is generally good. It has the omega-3 fatty acids that have anti-inflammatory properties and also help sustain the oil layer in your tear film. Moisturize frequently with blinking or artificial tears. If you're doing a lot of near work with the iPads or computer screens, it's important to take breaks. A lot of people don't realize that they're focusing so much on reading or internet surfing that they're not blinking as frequently, and then they get dry eyes and their vision gets blurry. It's always good to have a bottle of saline solution in the house or in the kitchen in case there's a chemical splash. If you wear contact lenses, it's advisable to renew your cases every 2 to 3 months. Also with eyelid rubbing, a lot of women wear eye makeup, and with the eyeliner, your eyelids are like rubber bands. So every time you're stretching your eyelids with rubbing or taking makeup off, it just stretches the eyelids more and makes them more loose. And that can lead to droopy eyelids, and that can cause a variety of problems. Also, if you're a contact lens wearer or you have dry eyes or a history of allergies, it's advisable to use hypoallergenic products. And of course, know your medical and family history, because systemic diseases do pop up and they can show up in the eye. So we all know that the phrase beauty is in the eye of the beholder. In general, what does society think is a beautiful eye? Well, generally, the conjunctiva or the sclera, the white of the eye is white. It's not red or injected. You have a nice lash, a lid margin with, full, thick eyelashes that kind of enhance your eyes. And then the cosmetic side of coloring and maintaining nice brows and whatnot. Things that can cause a red eye, there are many, many causes of a red eye, but it can include chronically dry eyes, blepharitis or inflammation around the eyelashes, allergic conjunctivitis, an inflamed pterygium, which is a growth of tissue on the inner corners of your eye that can occur from chronic dry states, or if you're out in the sun a lot, or you work in a dusty environment, things like that. Subconjunctival hemorrhages, so patients who are they're on blood thinners or they have fragile superficial blood vessels, any kind of internal pressure bearing down, straining, those things can cause one of those blood vessels to burst and cause a very red eye, which looks like the one on the right upper hand corner. And those are benign. There's nothing wrong vision-wise, there's nothing threatening, but it just takes maybe a week or two for it to go away. Corneal ulcers, so if you're a contact lens wearer, the number one cause of bacterial keratitis is actually contact lens wear. Iritis or uveitis, basically inflammation in the eye. And episcleritis or scleritis, which is the wall of your eye becoming inflamed. If you have a history of autoimmune problems, collagen vascular diseases like rheumatoid arthritis, lupus, those diseases tend to cause these types of inflammation states in the eye. And then there's patients who, if they have a small eye or they're very, they have a high prescription, they're farsighted, the angle in front of the eye can get narrow and in certain cases can cause acute glaucoma. And signs of high eye pressure could be acute eye pain, redness, blurring of your vision, and so those patients need to be seen immediately in the ER for laser treatment. So what about Visine? A lot of patients are asking, well, my eyes were hurting me, so I put some Visine in, and it didn't really seem to help. What do you recommend about Visine? Visine has a vasoconstrictor, and it does get the red out by constricting your blood vessels, but over time, if you chronically use the product, it will deprive your eye of the nutrients that are normally carried by the blood, which carries oxygen. So it can cause a state of chronic hypoxia. So we actually don't advise patients to use Visine. Lumps and bumps. So I see a variety of patients with lumps and bumps. They can range from skin tags or little papillomas, kind of benign growths on the eyelid, to styes and chalazions, to even basal cell carcinoma or squamous cell carcinoma. And so it is really important for you to be aware of these kind of growths occurring. If you have a little growth that's bothering you, it's very easy to take off in the clinic. It's an office procedure. For the styes and chalazia, we generally treat these with warm compresses and massage. But if they don't resolve, then we can go ahead and do a procedure to kind of drain the lesion. And for those of you who are fair-skinned or have had a lot of sun exposure, any little change in the eyelid, the way the skin looks, or if it's dry and it's not getting better with lubrication, you should come in and have it biopsied just to make sure that there's no cancer there. There's a variety of lash enhancements out on the market. This is one of my favorite topics. But it ranges from mascara to lash extensions to Latisse. How many of you know about Latisse? Can I see a show of hands? Okay, yeah. So, and then there's also a peptide serum. I don't know if any of you have heard of that. That's kind of, I guess, a newer product out. But, I mean, mascara is so common. Is everybody wearing mascara today, or I think it's the most affordable, really, and most practical. But there's the pros and cons of each of these, And with lash extensions, I've personally tried this myself. I've had it done professionally, and I've enjoyed the results because people seem to notice something about you, but they don't know what it is. The bad side about it is that it can irritate your eye. If they place it too close to your lash margin, it can pull out your eyelash. Your eyes can become very itchy. The Latisse, I'll talk about that a little bit later. Let's see if I can. Yeah, so here are the pros and cons. You know, if you have mascara that's not waterproof, or it's just not, it's kind of smearing, it can be a problem. The false lashes can fall out or pull out your natural lash. You can have some skin and iris hyperpigmentation with the Latisse, eye redness or itchiness, and then you know, the cost of maintenance is also an issue. But of course, we all think it's worth it because we get our full, thicker lashes. So Latisse is actually a product that was for glaucoma patients. It's Lumigan. Lumigan is a prostaglandin analog, and it's known as bimatoprost. Again, the indications are for glaucoma and hypotrichosis. The way it works in glaucoma is that the drug increases the outflow of fluid inside the eye, and so it decreases the pressure. And in its form for Latisse, it prolongs the anagen phase of the hair growth cycle. So actually applying it to the base of your eyelash for about 16 weeks can promote thicker, fuller lashes. So this is a diagram of the hair growth cycle. There's different phases, but the anagen phase is the active growth phase. The catagen phase is like a transition phase, and then the telogen phase is the resting phase. And so Latisse works primarily in the anagen phase by prolonging that active growth cycle. These are some of the celebrities that have had Latisse, and you can see the before and after pictures from week 0 at the top with Claire Danes, and then week 16 at the bottom, and then Brooke Shields as well. And I believe Claire Danes was saying that she had a little bit of skin hyperpigmentation that actually was reversible. It went away after a few weeks. The clinical studies with the product, they mention that as we age, the lashes do get thinner, shorter, and lighter, and this can begin as early as age 30. Patients who use Latisse consistently for 16 weeks they did grow thicker, longer, and darker eyelashes. Again, the side effects: eye redness, eyelid skin hyperpigmentation, itchiness, and if you have lighter colored eyes, like blue eyes, there's a possibility that it can become darker. Lash peptide serum, this I actually came across at a similar conference back in October. It was called Pamper Me Fabulous, and it was for women out in Huntington Beach who wanted to learn more about fashion and beauty. And there was a product called Cella that my mom actually bought, and it's the active component in a lash peptide serum is called myristoyl pentapeptide, or miracle peptide complex, and it stimulates the production of keratin, which is the protein that forms your eyebrows and your eyelashes. And they reported in clinical trials that this increased the eyelash length and thickness by about 25% in only 2 weeks, and about a 72% increase after 6 weeks.
Is this a prescription?
This is not. This is over the counter. Yeah.
Is Latisse also?
Latisse is prescription. Mm-hmm. And there's a variety of lash peptide serums out on the market. I was reading on topbeautysecrets.org They had a very thorough analysis of all the different types of lash serum peptides, Lashave, MD lash factor, rapid lash. My aunt gave me a sample of rapid lash, dermalash, enormous lash, and they categorize them by the overall success rate, the growth speed, skin comfort, easy application, and the cost. And some of these products range from, I saw about maybe the cheapest was $20 or $30, all the way up to close to $200. And so
get this kind of product from maybe Sephora?
you can, yes. Sephora, you can order them online, Amazon, and you can read the reviews for each one of them. Okay, so that's kind of a brief talk about some of the stuff affecting the outside of the eye, and we're going to move towards the inside of the eye and talk a little bit about cataracts, about glaucoma, and diseases related to diabetes and hypertension. Other things that you go to the doctor for if you're having flashes of light or floaters. It's also very important to have a dilated exam to make sure you don't have a retinal tear or detachment. And then also with your dilated exams, they should be checking for macular degeneration. So I don't know if any of you got an Amsler grid out at the booth. We have these magnetic Amsler grids that you can put on your refrigerator, and you can test yourself on a day-to-day basis to make sure that you're not developing any little blind spots that may be signs of macular degeneration. So be sure to get that when you go back to the booths. Some of the surgical advances at Loma Linda this year included the implantable miniature telescope, and that was a pretty big advance as far as surgery. And of course, we have many doctors performing cataract surgery at our institute, and we have cutting-edge interlace LASIK, which is blade-free technology for patients who are interested in refractive surgery correction. It also includes PRK treatment and PTK, which is phototherapeutic keratectomy. And we have a few doctors that are performing plastic procedures for droopy eyelids. So I'll talk a little bit about those too. So the implantable miniature telescope, have any of you heard about this? No? Okay. It's actually been on the news a few times in the last maybe 2-3 years now, and it's a very I think a very good thing for macular degeneration patients who, they've kind of exhausted their resources with injections. And so I'll talk a bit about what it is, who it's indicated for, where is it placed, and what the outcomes are. So the device, IMT, was FDA approved in 2010, and it's demonstrated to improve not only the vision but the quality of life for patients with end-stage macular degeneration. The product is manufactured by Vision Care Technologies, which is in Saratoga, California, up north, and it's part of this treatment program called CentraSight. So if you want to know more kind of on your own, you can go to the website centrasight.org, I believe, and you can put in information about yourself, vision-wise or whatnot, and they can tell you whether you're a candidate. So it's centrasight.org. This is some illustration here with the normal eye on your left side and how the vision is focused on the macula and diseased macula. The device, it magnifies the image 2.2 or 2.7 times, depending on the model that's chosen. And instead of projecting onto your diseased macula, it's projected onto the healthy perimacular areas, as you can see on the picture on the right. And this enables patients to see much better using the implanted eye and then using their peripheral vision with the other eye. The device is very small. It's about the size of a pea, and here it's compared to a dime. So it's very tiny, 3.6 millimeters in diameter by 4.4 millimeters in length, and it weighs 115 milligrams in air. On the bottom right is one of our patients' that had the implant placed. And so both patients, we had 2 patients, both of them did very well after surgery. I'll talk a little bit about kind of what their experience was like. There's very strict criteria for the implant. Patients have to be at least 75 years of age. They have to have the stable, severe vision impairment from AMD, evidence of what we call geographic atrophy, which is a thinning of the macula that you can see here on the upper right-hand corner. Patients also have to have a cataract to remove, and they have to go through pre- and post-surgical training with a low vision specialist, whether that's an optometrist or occupational therapist. They have to have adequate peripheral vision in the non-surgical eye to kind of use both eyes for a daily functioning. And when they're assessed before surgery, they have to have an improvement on the eye chart using an external telescope. Additional criteria include no signs of active wet AMD or no signs of eye disease other than well-controlled glaucoma, and no treatment for wet AMD in the past 6 months. The surgical procedure, it can range from 1 to 3 hours depending on the surgeon, and it's not your standard cataract surgery. We do take out your cataract and then place the implant in, and there's quite a few sutures that are used to close the wound. The sutures are removed later on. Dr. Gimbel was the one that operated on 2 of our patients at Loma Linda. And this took place April last year and October. And both patients did very well, had significant improvement in quality of life. The first patient was, I think she was in her 90s, and she was in a nursing home. And she was getting kind of depressed because she was really depending on a lot of her caretakers for just basic functions, eating. She couldn't see the food on her plate. After she had the telescope placed and she went through the therapy, the family members did note that she had, her spirits were uplifted. She was able to identify about 70% of the food on her plate, which was very good. The second patient was a little bit younger. He was, I believe he was in his 60s or 70s, and he was a retired vet. He was living at home, and his wife was his primary caregiver. And he couldn't see the telephone, pick up the telephone. He couldn't write checks. He couldn't see the medication that he needed to take for his diabetes or his hypertension. So after he had the telescope placed, even one day after surgery, he said he noticed images were larger, and I think 2 or 3 months afterwards, he was doing quite well. And these are pictures of the implant in the patient not too long after surgery, and you can see the eye's not really red or injected or cloudy cornea or anything like that. It's sitting nicely inside, and there are some sutures at the top there that you can also see. So Loma Linda right now has about 6 active cataract surgeons. And we do our surgery at the FMO Outpatient Surgery Center and also in Highland Springs and Beaumont. The procedure lasts about 15 to 30 minutes, and we have a variety of lens implants available for patients to choose from. With cataract surgery, we anesthetize the eye. How many patients here have had cataract surgery? Okay. Yeah, so you're familiar. It's topical drops numb your eye, and then it's a small incision surgery, and we use a phaco machine to remove the cataract, which is an ultrasound-guided machine. It breaks the cataract up into little pieces, and then there's a small irrigation vacuum system, and then the lens implant is placed, and there's no sutures. Patients go home and use eye drops for a couple of weeks. This is an illustration of the lens kind of going inside the capsular bag. The lens implants that are available include the standard monofocal lens, which is covered by insurance, but does require reading glasses to see fine print. And then there's the toric lens for patients with corneal astigmatism. Unfortunately, insurance doesn't pay for this, so it's about $600 out of pocket, and reading glasses are required after surgery. And then for the patients who can afford it and are candidates, the multifocal lens, which has little concentric rings that allow you to focus in the distance, kind of intermediate like a computer screen and then up close without the need for glasses, is available for about $2,400 out of pocket per eye.
How successful are those?
You know, it depends on a couple of factors, whether you have retinal problems, if you have retinal problems, it's probably not the best idea to go with a multifocal lens. If you have other factors like dry eye that's not well treated, that can cause a problem, because the expectation as a patient, if you're going to be paying more than $2,000 per eye for a premium lens, you want to have that 20/20 vision. So it kind of depends on what other factors are going on. If the doctor determines that you're a great candidate and you're willing to pay that amount of money, patients have had very good outcomes. Yes?
What would be the difference? Why would someone opt for this versus LASIK surgery?
Again, it also depends on what your situation is. Some patients have had LASIK surgery before, and then they can get their cataract implant later. We have to use a different formula for calculations for the implant based on kind of what your prescription was before the LASIK and what your prescription ends up being after LASIK. And if the astigmatism has already been taken care of, it may just be better to go with a monofocal lens. So it all kind of depends. Yeah, so how do you know if you're a cataract surgery candidate? Well, if your vision is worse than 20/40, even with your glasses on or on glare testing, if you have significant glare or halos when you're driving, fuzziness, haziness, you know, the picture here kind of simulates that condition. If you're having difficulties driving at night, then it may be time for you to come in and just get evaluated for the cataract. And it may not be at a point where you need surgery right away, but it's good to just have it monitored. Refractive surgery at Loma Linda, again, we have a wavefront technology to customize the treatment. Again, we have the blade-free technology with the intralace femtosecond laser, and that laser is the one that creates the flap. And then the Vizix Star S4 is the excimer laser that reshapes your cornea. This is kind of what it looks like in our laser suite. On the left-hand side is the intralace where the flap is created, and then to the right is the excimer laser that does the ablation. This is just a diagram showing you kind of how the laser flap is created. It's, they're little bubbles that are created in the stroma or the midsection of the cornea. And once those bubbles are created with the laser, we use a small instrument to kind of lift the flap up. And once the flap is lifted, we can do the laser that ablates your cornea for your correction. So how do you know if you're a refractive surgery candidate? Christy, she's our LASIK coordinator, so we do offer free screening and consultation. During that session, you'll get an auto refraction. We'll check your corneal thickness, your corneal topography. Patients who have thin corneas or who have very dry eye or have extreme prescriptions may not be a very good candidate for the laser treatment. For PRK is when we don't make the flap, we just kind of take off the epithelium and do the laser ablation without a flap. And it's generally for patients who have a little bit higher prescription. Patients have to be over the age of 18. They have to have a stable prescription over the last year, cannot be pregnant, and their pupil size has to be 6 millimeters or less in a dark room. It's just more ideal for the outcome. Again, patients with autoimmune diseases, collagen vascular diseases, thin corneas, or a condition called keratoconus where the cornea is shaped abnormally. These kinds of things, severe dry eyes, contact sports, or jobs requiring high visual acuity you may not be the best candidate for it. And again, LASIK surgery does have its complications. It can range from dry eyes or glare and halos to recurrent erosions or reduced vision in low light settings, corneal haze or scarring. So now that we've talked about laser, what about my eyelids? A lot of patients think that eyelid surgery is just cosmetic. It's not. If you come in and get evaluated and you feel, my eyelids feel a little bit heavy, or maybe I'm not seeing as well when I'm driving, I see better when I kind of lift up my eyebrows and my eyelids. We can do certain tests in the clinic to prove that having surgery to lift your eyelids or to remove the excess skin will help you functionally, and insurance does pay for that. This is a less severe case, but you can still see that there's a little bit of hooding, or the eyelid skin is kind of coming down across and over the eyelashes. So if you're a surgical candidate, you'll have a visual fields with your lids taped and untaped, and what that does is kind of simulate how you would see if you got the surgery. And this is kind of an example of a patient who has dermatochalasis or excess eyelid skin, and she has the surgery done, and you can see it kind of just brightens up a little bit and gives relieves that heavy feeling. We also take pictures to submit to the insurance company as well, and the procedure is about a 45-minute outpatient procedure. An additional eyelid surgery is called ptosis repair, where it's not necessarily the excess skin, but a loosening of the eyelid muscle. So the patient on the left with her right eye, you can see a difference in the way the eyelid is contouring the globe, and also here on the right-hand side. The patient on the right-hand side had the surgery done, and you can see it's a tightening of the muscle that lifts your eyelid. And it's very similar to blepharoplasty, it's just an extra suture. And then if you're noticing that you have constant tearing down your cheek, or a foreign body sensation in your eye, or your eyelids chronically red or irritated, you may have an ectropion or an entropion, which is a looseness or laxity of the lower eyelid that causes it to turn in, as an entropion here, or an ectropion on your left-hand side. And these are pretty simple to fix. It's about 15 minutes, 20 minutes outpatient procedure. We use some sutures to just rotate that lid margin and then tighten the lid up. And also facial twitching. So this can be due to hemifacial spasms or blepharospasms, and if you're starting to notice maybe you're just having a few twitches and not sure what's going on, could come in and just have a consultation. But with the hemifacial spasm, it's kind of the one side of the face is starting to kind of contract, and it's thought to be due to a vascular compression of the facial nerve. So sometimes we will scan patients with an MRI just to make sure there isn't anything compressing on the facial nerve or the internal carotid artery. Blepharospasm can occur in patients who have a history of dry eyes or light sensitivity, multiple sclerosis, and there's been an association with benzodiazepine withdrawal. And so generally the treatment for these conditions is Botox, and The injections are done every 3 months or so, depending on how the patients respond. And this is kind of an example of where around the eye we do the Botox injections, kind of right in between the forehead area and then around the eyes. And we can kind of titrate the amount of Botox we give depending on how the patient responds. If there's kind of a droopiness, then we give less, or if they're still twitching, we give more. And so in conclusion, eye health is very important, and there are many systemic diseases that can show up in the eye. Remember to get your annual exams with your optometrist or your ophthalmologist, and don't forget the 10 tips for keeping your eyes healthy and pretty. And if you're interested in any of the surgical procedures or just want to get a basic eye exam, please do not hesitate to make an appointment in our eye institute. Are there any questions or? Mm-hmm.
What, if anything, can be done for puffiness under the eyes?
Yeah, so unfortunately, for surgical purposes, lower lid blepharoplasties are considered cosmetic, so insurance doesn't cover that. I've recommended patients to use cool compresses, things that can help decrease swelling. Sometimes it could just be fluid retention and kind of the thinning of the tissues in that area. Mm-hmm.
Back to IMP,
Mhm.
fascinating. Does that affect the iris's ability to accommodate the light?
Yeah, it actually does, because the implant, even though it's really small, it's actually a lot thicker than the regular implants we place for cataract surgery. It's a little bit thicker, it's about 3 millimeters thicker. So it does kind of protrude out to the iris. So the iris cannot constrict all the way. But for those two patients, I don't think they were having any problems as far as, the iris didn't need to come down anymore, so.
And then what do you think of those supplements like it's called Ocuvite,
Mhm.
because lutein and omega-3 fatty acids and that type of thing?
Yeah.
Help that macular degeneration rate of tears a little bit more viscous, I
Yes.
guess. Do you think that would be advantageous, or do you think it's primarily for the eye?
Yeah, patients do ask about, can I just take eye vitamins if I don't have macular degeneration? And you really don't need the Ocuvite if you don't have macular degeneration. I would recommend patients obtain those through your diet, or if you have the supplements for the omega-3, that's fine. But the Ocuvite, the ones that are with the lutein, those are more geared for the AMD patients. And generally, those patients, we recommend, once you have the macular degeneration and you're kind of at the more intermediate stage of the dry AMD, is when we kind of promote usage of the vitamin supplement.